the drugs for gout. The drugs for gout. So in gout, we have the drugs for acute gout and the drugs for chronic gout. If nothing is written, then think about the chronic. So chronic gout or gout. What is the aim? The aim of treatment in acute gout is, the aim of treatment in acute gout is, the aim of therapy in acute gout is to control pain and inflammation. To control pain and inflammation in the affected joint. In chronic gout, what is the aim? The aim of chronic gout is to prevent the attack, so it decrease the uric acid level. Decrease the uric acid level because in gout there is hyperuricemia. So first, what are the drugs for acute gout? So guys, in acute gout, what are the drugs? So drugs used for acute gout. So first we can use the NSAIDs. So I told you we can use the NSAIDs for this purpose. Non-steroidal anti-inflammatory drug, we can use the naproxen-like drug. Naproxen, indomethacin-like drugs can be used. Never ever use the aspirin. Aspirin is contraindicated. So which NSAID is not used in acute gout patient, that is aspirin. The reason is very simple, that aspirin can inhibit the uric acid excretion. And because of that, it increases the uric acid level, so it can precipitate the gout. So not use. Aspirin is contraindicated. If suppose NSAIDs are not effective, so if you ask me the drug of choice for acute attack, then in acute attack the drug of choice will be NSAIDs. But if NSAIDs are not effective, then the second important drug, we can use the colchicine. We can use the colchicine. Colchicine is the anti-inflammatory, very good anti-inflammatory. Colchicine is inhibiting the mitosis, so it is the mitotic inhibitor. It is also inhibiting the leukocytes migration or neutrophils migration. Leukocyte migration towards the inflamed joint. It is inhibiting this leukocyte migration, so very good anti-inflammatory. It is used for resistant. It is used for resistant cases of acute gout. So it is used in resistant cases of acute gout. It is not the drug of choice for acute gout, it is the drug of choice for resistant cases in the gout. Why it is not the drug of choice for all acute gout patient? What is the risk with colchicine? So guys, the risk or side effect with colchicine, the most common side effect is it can cause diarrhea, so gastric side effect, diarrhea, pain, abdomen. But the risky thing is, the dangerous thing is, so serious side effect is, it can cause the bone marrow suppression. It can cause the bone marrow suppression, so risk of neutropenia, thrombocytopenia, anemia is there, mainly neutropenia, agranulocytosis. So see, that is serious side effect, bone marrow suppression, but common is diarrhea. That is why it is not a choice of drug. Now, so these are used in the acute situation. We can also use the intralesional or directly in the joint, we can use the steroids as well, but that is not the choice of treatment. So corticosteroids can also be used for the resistant cases where there is no option available. But mainly NSAIDs and colchicine, these two drugs are used. Now guys, what is the drug for chronic gout? So the drug for chronic gout, so after this, the drug for chronic gout, in chronic gout, the aim of the treatment is to decrease the uric acid level. So the drugs used for chronic gout, drugs used in chronic gout. So in chronic gout guys, we use the drugs which decrease the uric acid level. So you can divide the drugs into three parts. First, decrease the uric acid synthesis. Decrease the uric acid synthesis. Second, increase the uric acid excretion. These are also called as uricosuric drugs. Uricosuric. And the third is increase the uric acid metabolism. Increase the uric acid metabolism. So metabolizing the uric acid, normally we do not have any enzyme in our body for uric acid metabolism, but these drugs can metabolize the uric acid to allantoin. So what are the drugs? In uric acid synthesis inhibitor, we have the xanthine oxidase inhibitor. We have the xanthine oxidase inhibitor, and in this xanthine oxidase enzyme inhibitor, we have the two important drugs. One is allopurinol. The metabolite of allopurinol can also be used, that is oxypurinol. Oxypurinol is the metabolite of allopurinol. So remember, this oxypurinol is short acting, allopurinol is the long acting drug. And the second is febuxostat. So xanthine oxidase stat, inhibiting the xanthine oxidase. Both these drugs can be used for this chronic gout patient, but out of these the best drug is allopurinol. So allopurinol is the drug of choice for gout patient, or allopurinol is the drug of choice for chronic gout therapy. We'll discuss about it. Then guys, the uricosuric drug. In uricosuric drug we have the proben acid, sulfenpyrazone, and benzobromurone. Proben acid, sulfenpyrazone, and benzobromurone. Benzobromurone is safe in renal failure patient. It is safe in renal failure patient. So these are the drugs which are used as uricosuric drug. Proben acid have been used with penicillin to increase the duration of action of penicillin. So these are uricosuric drug. Now guys, the drugs which increase the uric acid metabolism. So as I told you, we do not have any enzyme for uric acid metabolism, but Bud uricase enzyme have been used, and this is recombinant Bud uricase enzyme. So recombinant Bud uricase enzyme. So this drug is called as rasburicase. So by name only you can see recombinant Bud uricase. Rasburicase, we have the pegloticase. So rasburicase, pegloticase, these drugs are recombinant uricase from the buds. They are converting the uric acid to allantoin. Uric acid will be converting to allantoin. So this is the uric acid metabolism, and that is excreted through the excreta. So these drugs also used for hyperuricemia. But for gout and hyperuricemia, overall best drug is allopurinol. It is the best drug for allopurinol for chronic gout patient. Allopurinol, the main risk with allopurinol is there is risk of hypersensitivity reaction. But if you will compare with the febuxostat having less risk of hypersensitivity, allopurinol is overall best drug for gout patients. So these are the drugs which are used in chronic gout patients or gout therapy. So that is about the Autacoids. So guys, we have discussed almost every drug in the Autacoids or in almost every chapter. So that's all. Thank you. Bye bye.